Hello, everyone. The following demonstration will assist Medicare Promoting Interoperability Program participants in navigating hospital quality reporting, also known as the HQR System or QualityNet as we previously called it. This video will specifically contain the steps on how to submit data for the Medicare Promoting Interoperability Program objectives and electronic clinical quality measures, or ECQMs, for the 2023 EHR reporting period in the HQR system. Once you're logged into the system, you can then begin submitting your objectives and attestation information. In order to do that, you'll want to validate that up here, this is the name of your facility that you're trying to submit data for. You'll come to the left navigation bar. You'll select Data Submissions. From here, you'll want to click on the Web-Based Measures tabs, click on Data Form, and select PI. On this form, we're going to be demonstrating submitting data for the 2023 program year. I do want to call out this banner at the top of the page. It will remain throughout the entirety of the reporting period. For this demo, the reporting period is expanded. For 2023 reporting, we normally will have the submission period be January 1st of 2024 through February 29th of February 2024. This banner will stay up the entirety of that submission period. If you click on Upload, it will take you over to the ECQM section, which will show you after we finish out the web form, where you would submit your ECQM data. On this page, the first thing you would like to do is verify that the CMS certification number is in fact the one for your facility that you're reporting data. The submission period in the production system will show January 1st, 2023 through December 31st, 2023. We have this changed for the demonstration. First thing we're going to do is click Start Attestation and Disclaimer. In here, you will be required to provide your EHR number. It will validate this number to ensure that you're using the most up-to-date version of the software. If not, or if you do not have the correct amount of digits, it will highlight this in red to warn you that there's an error and allow you to fix it before you submit your data. We will then select our method of reporting, observation method, or all ED visits. You will then enter your 90-day reporting period. With this date range, you can do more than the 90 days, but please remember that the 90 days is the minimum required. This box here is letting you attest that you either have or will submit your clinical quality measures via QRDA file on that ECQM tab that will show at the end of this demo. The next is the attestation statements. Please make sure you read through these and either agree or not agree based on your facility information. And then you'll submit that. That will take you right into the next step, which is the attestation disclaimer. Please make sure you read through the general notice and what your signature is committing to by signing this. This is for the person that is entering the data for the program year. It does change each year. Once you acknowledge that, you can submit. And then next, we'll proceed to our objectives. The attestation and disclaimer information is available to be edited all throughout the submission period. It can no longer be changed once we pass that February 29th, 2024 deadline. Starting the objectives, the first one that it will pull up is Protect Electronic Protected Health Information, or EPHI. You would either, yes, you had reviewed the security risk analysis, or no, you did not for your facility. And as you submit, it's going to continue to move you through each of these objectives. If for some reason you need to change an objective or go back to a previous one, you can certainly just click on that link and it will open it right back up for you. The next one is the SAFER guidelines. For this 2023 reporting period, you would answer yes or no. Now we're on to electronic prescribing. In here, you would want to read the exclusion and determine if it does or does not apply to your facility. If it does apply to your facility, you would just select yes, and you can move on to the PDMP question. If it does not apply to you, it will then open up fields for you to enter your numerator and denominator information collected by your facility. On the query of prescription drug monitoring program, you have the option to select yes or no. Moving on to health information exchange. On this objective, please keep in mind you have 3 options of reporting this. Depending on which option you select, there will be additional fields that open. If you select the first option, which is support electronic referral loops by sending health information and support electronic referral loops by receiving and reconciling health information, this is the option that will open those additional fields where you would then again have to enter the numerator and denominator for each of those questions. If you select the second option, which is engagement in bidirectional exchange through health information exchange, that is the only selection that you will have to make, or enabling exchange under Trusted Exchange Framework and Common Agreement. Then you would select yes or no, submit, and it will move us on to provider to patient exchange. In this objective, you do need to enter the numerator and denominator information of your facility. This one does not have an exclusion. And lastly, we'll move on to public health and clinical data exchange. For each of the measures, there's 4 required measures and there's the 2 bonus measures. For the first 4 mandatory measures, you would select your response, either yes or no. And then you also, for each of these, need to select your level of engagement for your facility. If you select no on one of these 4 measures, it will then ask you if an exclusion applies to your facility. Please make sure you select yes or no on the exclusion, and the required fields are denoted by the red star next to each one of them. On these exclusions, it does open up all available exclusions. Only one should be selected, but it is a required field. So if the first exclusion applies, please mark no to the other 2. If the second one happens to apply, you would mark no on 1 and 3 and yes to the second exclusion. Again, if you select yes on these, you will be required to also respond with your level of engagement for your facility. These last 2 measures are for the 5 bonus points for this objective. They are not required. However, in order to get the bonus questions the bonus points, you would need to report on both of these, as well as your level of engagement. You can then submit the form and you will see your final score. The green indicates that you did meet the minimum score required to be successful on this piece of PI reporting. If you made an error after you submitted the data, you can go back and you can edit these at any time during the submission period. Up at the top, you will see the Export Data button. We do recommend, once you're satisfied with the data that you have put into the system and you are no longer going to change it, please go ahead and click that Export Data form. It will pull it up in a PDF and you can save it for your records. You can save it on your desktop or you can send it to administrators if needed. As stated, the last piece of promoting interoperability that we'll need to do is to upload our ECQM data. You can click this upload, or you can go back to the dashboard you can go to Data Submissions again, and here you can upload your ECQM data. Please make sure when you're uploading this data, you click on Production. If you select Test, that is going to tell the system that it is a test-only file, which is allowing you to review how your data is submitted and whether it would be accepted into the system, but it does not count toward production data. So you'll want to select Production when you're ready to submit your file. You will grab the file from wherever you have it located on your current system, and you just drag and drop it into this box here. That will then finish up your ECQM reporting. Once your data has been accepted into the system, you will want to come to Program Reporting from the left dashboard, and you'll select Program Credit. On this Program Credit screen, you'll want to select PI as your card, and you can then go and pick the quarters of the data that you're reporting for ECQM. You can select it, and it will tell you on this box whether you've met or not met the ECQM reporting requirements for the 2023 program year. All 4 quarters will be available and previous quarters, but for this year, it will be all 4 quarters, and it will also remind you of what the requirements are to meet the ECQM requirements. For the 2023 program year, you would need to report on the safe use of opioids, as well as 3 other measures of your choice. Those 3 measures must be the same measures across all 4 quarters reporting the data in order to make you successful in ECQM report. That concludes our demonstration on how to attest. Thank you again for watching this video on how to submit your data for the 2023 EHR reporting period in the HQR portal. If you need additional assistance or have additional questions, we encourage you to reach out to the CCSQ Help Desk by emailing qnetsupport@cms.hhs.gov or by calling 1-866-288-8912. Thank you.